Here I'm going to discuss the anatomy of the carpal bones and then discuss the clinical symptoms that can arise from fracture of certain one of these bones. So the wrist is connecting the forearm to the hand bones, and the wrist bones, also known as carpal bones, are made of two rows. The proximal row, which is made of a scaphoid, lunate, triquetrum, as well as the pisiform bones, and then the distal row, which is made of a trapezium, trapezoid, capitate, as well as hamate bones. And one memory aid that I have for you to keep remembering the order of these bones is called some lovers try positions that they cannot handle. So once again, some lovers try positions that they cannot handle. And so this way you can remember the order of the carpal bones. So once a patient presents with a fracture of a carpal bone in the emergency department, what you will have to do is that you will have to provide them with splinting in order to immobilize the carpal fracture. And so usually on the initial x-ray you may not be able to see the fracture, but once you repeat the x-ray in 7 to 10 days, that's the time that you will be able to see the fracture. So just keep that in mind. On initial presentation, you may not be able to see the fracture on x-ray, but once you repeat the x-ray in like 7 to 10 days, that's the time that you will be able to see the fracture. Now here I would like to ask you a question. Out of all the carpal bones that are presented here, which one of them is most commonly fractured? And the answer is scaphoid, also known as navicular bone, is the one that is most commonly fractured. In fact, out of all fractures of carpal bones, scaphoid accounts for about 60 to 70% of fractures of the carpal bones. And these patients generally present with pain over anatomic snuff box. So there would be pain over the anatomic snuff box, and the reason this region of the hand is called anatomic snuff box is that in the past they used to use this area of the hand to sniff tobacco, and so therefore the name snuff box has been given to it. And since it's in a close proximity to the scaphoid, these patients can present with pain over the anatomic snuff box. In addition, since there are tenuous blood supplies to the scaphoid bones, patients can also present with a vascular necrosis. So once again, scaphoid is the most commonly fractured carpal bone. It presents with pain over the anatomic snuff box as well as a vascular necrosis. The next bone I would like to talk to you about is lunate, but before I talk about that, first I would like to provide a quick background on the carpal tunnel syndrome. So as you can see, the median nerve is passing through the carpal tunnel, which also has 9 other flexor tendons of the forearm musculatures. And so once there is compression of the median nerve, that's the time that patients will present with the carpal tunnel syndrome, where there would be pain and paresthesia, which means there is tingling sensation over the areas that are being innervated by the distal median nerve. And the 2 tests that are used for diagnosing the carpal tunnel syndrome includes the Phelan test, where you will have to put the back of the hands against each other. So let's say that this is your hand, here is the back of your hand, and here is the other back of your hand, and here you have the forearm. So you will have to put the back of your hand against each other for 1 minute. And then after 1 minute, since there is too much pressure right now, compression of the median nerve, patients will start to present with pain and paresthesia if they have the carpal tunnel syndrome. And then the other test that you can use is the Tinel test, where you will have to percuss over the course of the median nerve on top of the carpal tunnel. And then these patients again present with pain and paresthesia if they are having carpal tunnel syndrome. Now, the reason I've discussed the carpal tunnel syndrome here is that dislocation of the lunate can lead to the carpal tunnel syndrome because it's in a close proximity to the median nerve, and so therefore one of the symptoms of the lunate fractures as well as its dislocation is the carpal tunnel syndrome. And then the other symptoms that you will see with lunate fracture is the median claw. So the median nerve is innervating the lumbricals of the 2nd and 3rd digit, while the ulnar nerve is innervating the lumbricals of the 4th and 5th digits. And these lumbrical muscles are the intrinsic muscles of the hand that are required for the extension of the interphalangeal joints. So what happens once there is a lesion of a median nerve, these patients cannot open their 2nd and 3rd fingers once you're asking them to straighten their fingers. So once they're trying to open their hands, this 2nd and 3rd finger would not open if there is a lesion of a median nerve. On the other hand, if there is a lesion of the ulnar nerve, then the 4th and 5th would not open, and that would be called ulnar claw. But let's forget about that. Here we are talking about the median claw, which is caused from fracture of a lunate. So fracture of the lunate bone will damage the median nerve, as a consequence of which patients present with median claw, where they cannot extend the 2nd and 3rd digit when you ask them to open their hands. And then the final fracture I would like to talk to you about is fracture of the hook of the hamate. So here we have the hook of the hamate, and you can see that it's running over the ulnar nerve. So fracture of the hook of hamate can cause damage to the ulnar nerve. And ulnar nerve, as I just told you earlier, is innervating lumbricals of the 4th and 5th digits. So once you ask these patients to open their hands, since the lumbricals of the 4th and 5th digit, due to the fracture of the hook of hamate, which has damaged the ulnar nerve, would not be able to open these 2 fingers. So therefore, these patients will present with ulnar claw, which means that their 4th and 5th digit cannot straighten once you're asking them to open their hands. And that concludes our discussion of the carpal bones and the symptoms that can arise from their fractures.